Hello and welcome back to Module 6. This is the exciting bit. This is the owner's role part 1. So we've covered quite a lot of ground already and we're now in 2 modules on you, the owner's role. So going back to that diagram, the true multimodal management of arthritis. We have our vet control and we have our owner control. And as you can see, you guys, you are doing a lot, almost overshadowing what we as vets do. You are the people that are in control of lifestyle changes. You observe and tailor your treatment plan, and you discuss your findings with your vet to help them tailor their treatment plan. And then you rebuild your lives together. And what do we mean by that? We mean by physically rebuilding. Remember back to module 1, arthritis isn't just a disease of the joint. It's not just a disease of the limb. And it's not just a disease of the body, but of the whole dog. And remember also, it's not just a disease of the dog. It affects the owner-dog relationship. So when we talk about rebuilding, we talk about your relationship and looking at how it can be maximized, but different. An illustration of that is with my own dog. We used to do many active things, paddleboarding, hiking, running. But as she developed arthritis, these had to change. And we started looking at doing more low impact exercises together and spending quality time together differently. So we're going to start with lifestyle changes. So lifestyle changes, one way is to look at all the different aspects of your dog's life. Everyday exercise, weekend walking, feeding, hobbies, sports, sleeping, playing, and mooching around at the home. We want to look at weight control, feeding appropriate diets, appropriate daily exercise, not doing too much or too little, not playing inappropriate high-stress games, sensible training regimes for these high-impact hobbies, and preventing injuries in and around the home. So everyday exercise, what does this mean? Okay, it's an appropriate amount of exercise per day. Often with cases of arthritis, it needs to be shorter amounts of exercise more frequently. Allow them a gentle warm-up. Tailoring the exercise to how they feel. Go back to your objective markers. If you've got a day when Holly, her tail is down, her back is arched, her ears are back, and she's whisking with her back legs and you can hear the toe clipping, take it light that day. Just do a short, little and often. Potentially replace one of the walks with a food-filled Kong for her to entertain herself. She might be going for an acute flare, and by tailoring her activity accordingly, she'll come out sooner the other side. Think about the terrain that you walk in. Are you trying to walk a dog that has poor muscle mass and painful joints on a beach or up a steep hill? Think about crazy time with their playmates. We all know those neurochemicals can block pain for transient periods of time, allowing them to do things that they might not wish to do when they feel the after effects. Consider that throwing balls and frisbees are going to release all these amazing neurochemicals that are going to block their ability to feel how uncomfortable they are and lead to them overdoing it. Think about your route. Can it be cut short so you can get back to the car quick if you can see that they're showing signs of struggling? And also consider your transport there and back. Is it safe? We don't like to see these dogs jumping in and out of cars or rattling around in the back of an empty boot. So here is a short clip from David Dicus talking about appropriate exercise.
We really want to change the paradigm shift of saying, here's your tramadol and your anti-inflammatory, and there's really not much more else we can do. What we want to do is really establish our baseline. That baseline is going to be through things like our joint supplements and our omega-3 fatty acids, but more importantly, diet, daily exercise, and daily playtime. Daily exercise is not running around chasing squirrels in the backyard. Daily exercise is actually getting out, going on a walk. And what I want is for dogs to be able to go on at least 20 minutes twice a day, level ground, and ultimately when they have flare-ups, knowing that we're going to have good days and bad days, and quite commonly when they come see you in the practice, they're probably in the middle of a flare-up. Otherwise, why would they have come to see you in the first place? And so when we have flare-ups, what we want to do is kind of take a step back from our activity and say, what can we do to get this flare-up under control quickly and aggressively? And so sometimes we turn to pharmaceuticals. However, with our NSAID usage, we want to start at the lowest dose possible, as infrequently as possible, and then say, okay, maybe we should add in joint injections to get the joint quiet. Maybe we need to add in formal rehabilitation therapy. Maybe we need to add in acupuncture or other modalities to get them comfortable, because at the end of the day, it's all about keeping them comfortable so they can stay active, so they can minimize loss of range of motion, and also so they can maintain a lean body weight. Because if we have patients that are uncomfortable, they're just going to sit around. They're not going to be active. Then they're going to gain weight. Then they're going to get stiff, and then they're going to lose range of motion. And so I think we can do a lot more for our patients when it comes to arthritic management if we take a very patient-centered, patient-specific, multimodal approach, knowing that what one patient may benefit from, another patient may need something else.
So, car access. As mentioned previously, this is really important. They're generally excited to be going for a walk and therefore likely to injure themselves. We, as vets, believe that it's a common cause of seeing acute flare-ups, the high concussional forces that they have to endure jumping out of that back of that vehicle. We like to see people employing the use of dog ramps for dogs that can't be easily lifted in and out without subjecting yourself to harm. Or you could even choose a walk where the owner can park a car near a natural ramp or a curb to reduce the distance that dog has to travel to get in and out. Maybe use the passenger footwell because it's lower to the ground than a high boot. Use a step or even use a harness to help. Please note, asking a dog to use a ramp unguided can be very, very unnerving for them. If they're already weak and uncomfortable, their sense of balance might be also affected, and coming down a steep, narrow ramp will really affect their confidence and they might fall. So please employ some kind of harness support to make sure that they're safe doing so. Consider when they're in the car. So when they're in the car, have they got suitable padding so that they can have a comfortable ride? We don't want to go to all these great lengths to then leave them on a cold, solid boot floor to rattle around in the back uncontrolled as we go around corners. Do think of what it would feel like for yourself being sat in the car, unable to predict the next corner or the next bump. Appropriate exercises whilst on walks. I am a massive advocate for not just ploughing on your walk and getting your mobile phone out or talking to your friend. I look at the surrounding terrain and I try and encourage Holly to do gentle hill walks, up, down, zigzagging. I ask her to do some exercise such as give paw and swap and change and weight shift. So the walk doesn't just have to be a two-dimensional walk. You could actually do some really appropriate exercises during your walk, and a physiotherapist consultation would certainly help you in the right direction to adding these to your daily exercise. Don't be scared of using the wheels on a walk. This is something that I was a little bit nervous of initially. However, I must admit, if it wasn't for these wheels, me and Holly wouldn't have done the 100 miles South Downs Way last year to raise awareness about arthritis. It was an absolute godsend, even though the front wheel fell off. But luckily, somebody came to our assistance. Many smaller dogs can be carried on walks, so you can still do the distance, but when you see the signs of tiring, fatigue, or them beginning to struggle, pick them up, carry them, and continue on your way. Weekend warriors are something that we're all very aware of. We all have busy lives with very complex jobs, and we find ourselves not having time to exercise our dogs like we would during the week. And then come the weekend, we want to spend quality time with them in a beautiful location, taking a 2-hour walk to get to a cafe to then walk back. This is a lot to expect from the average short walk during the week. So consider these walks, plan ahead, think about the terrain, think about who you're going with, think about having stops for recovery. Feeding. So feeding is a chance where you can really make their life a lot more comfortable. Consider raising the feeding bowls to around about shoulder height and the water bowl. Make sure there's a non-slip area around the feeding station. Prepare the food away so that they don't get excited and fall. Many dogs are very excited before feeding time, and you'll find they'll be looking up at you whilst you're preparing it on the counter, and they'll be slipping and sliding on the kitchen floor. So maybe doing it out of their sight would be a good way to minimize this. I certainly feed smaller amounts more frequently because I know my dog loves eating. So by feeding her smaller quantities throughout the day, she gets that enjoyment and it gets her up and moving. I like feeding her in interactive ways, such as in Kongs or in licky mats, and I often hide the food in little cardboard boxes so that it makes her use her brain, makes her use her body, and she gets enjoyment throughout the day. Scatter feeding is another way that you can improve your dog's enjoyment and movement whilst having essential daily activity. So some people approached us and said, what about the risks of bloat with using raised feeding? Just to extend upon that point, there has been 2 studies. One study showed no evidence of risk, whereas the other one showed evidence of risk in giant dogs. The evidence therefore is weak, but neither showed increased risk of bloat if they were fed from the floor. So what we would suggest is certainly feed the water from a raised platform, and if you choose to feed their food from a raised platform, maybe smaller quantities so they have to eat slower. As mentioned previously, interactive feeding options are great for distraction. Regular movement, controlled movement, the repetitive behavior can be good distraction and calming for the brain. And it's really a very accessible way to introduce dieting because you're feeding smaller quantities, but they're taking longer to eat it. Looking at their hobbies and sports. Is the hobby suitable for them or is it for you? Now that's a harsh thing to say because many of us enjoy the social side that comes with owning a dog and pursuing these activities. But just make sure that they are capable of performing these hobbies without injury. Does the difficulty setting need to be changed? This is quite a high jump for this little dog. Do they have sufficient training in place ready for events? Or are you expecting them to perform a high level exercise without any sufficient physical training? Are you aware if they're stiff or sore a few days after? Is that something that you need to take note of? Maybe get a vet check that there isn't a problem, or do you need to change your training and expectation? This is a short video to just give you guys a little bit of a reality check about what is possible, especially in high drive dogs. We have to remember that these high drive dogs will work through pain. A certain heroine of mine, Dr. Chris Zink, states that dogs generally don't show pain until they're 6 out of 10 in pain. That's quite significant. So please just watch this clip from Sherman Knapp at the VOSM in the US, and it shows what a dog is willing to endure and still perform.
So what you're looking at here, this is the biceps tendon, and it looks like, as you see, the tendon right at the very top to the right, looks like somebody took an axe and just chopped it right in half. There's probably only about 10 to 15% of this tendon still attached to the bone, if that, and so it's completely ripped off. That's your subscap, and those little things dangling right there should be the MGL, the major stabilizer of the shoulder. It's gone. The tendon of the subscap is completely destroyed. You can see where pieces of it that attach to the bone are pulled off, and you can't see any normal fiber pattern. Labrum's torn. That's the rest of your MGL there, the main stabilizing ligament just floating. Now we're coming to the joint capsule, which doesn't look like a capsule. It should look like a smooth rubber, kind of distended rubber band or rubber balloon. And now you can see this severe inflammation in the back portion of the joint. And look at the cartilage on the round surface. That's the humeral head. It's all fibrillated. It's like craters on the moon. It's all deteriorated. This is probably from chronic wear and tear as well as microinstability from the medial shoulder syndrome. And so without a doubt, the worst shoulder I've ever seen in a border collie in my entire life. And so from top to bottom, front to back, there was pathology everywhere. I'm not quite sure what was keeping this shoulder joint in the socket. We work our way back up again. There's the capsule. Look at the cartilage above here in a second. You're going to see where the top portion from big bone spurs were catching and grinding on the back portion of the humeral head. So the ball and socket were catching against each other and just wearing and tearing. Right there you can see the abnormal contact, again, from chronic breakdown of the shoulder. There's your ligament again that's gone, your tendon that's gone, front portion of the ligament that's gone. And we work our way back to the capsule. We really shouldn't be able to see all those areas of the subscap because there's usually capsule and MGL there, but it's completely destroyed and disintegrated. Working our way back anteriorly, there's our biceps again, and just completely ripped off the bone. So it's not functional. It's like getting your hair pulled. Every time you take a step, it's just pulling on the nerve endings and the little bit of tissue that's still attached. So completely non-functional shoulder.
Sleeping. So dogs do sleep for a lot longer as they get older, and it's certainly something that we can influence. Watching a dog laying on a cold, solid floor in a drafty area on a slippery flooring often means that they get up stiff and therefore more likely for slips, trips and falls. By providing them with suitable bedding that's got good traction, is firm and predictable, is easy to get in and out of, is in a low traffic region so that they're not always disturbed. It's not full of bedding and toys that means that they're going to trip over and stumble and find it difficult to get comfortable. It's not full of blankets that they're going to get their feet caught up in and trip. So consider where they're sleeping and make sure it's hazard free. If they do sleep on your bed, are they able to get on and off easily, or does it need to be adapted to make sure that they're not having these concussional forces or these exertional forces to achieve this? Playing. We all love seeing our dogs play, but they are very excitable at this point. And do think again about the neurochemicals. Tough and tumbles can look fun at the time but end in discomfort later. So just be willing to moderate the amount. And if it's looking like it's getting a bit rough, maybe call it to a premature end. Mooching at home. So many people believe that dogs won't do anything that would hurt them. Well, I'm afraid I disagree. They do what may hurt them. Our home environment is full of hazards that they have to navigate daily. And these can lead to further injuries on top of their arthritis. Slippery floors, stairs, steps, patio, decking, thresholds and sofas. They all can come with risks. And these risks might be small in an individual event, but being repeated 10, 20, 100 times a day can manifest into something much more significant. We are very aware of this with our own human arthritis, and you won't find it hard to find aids to make living with this condition easier and safer. However, there's not very much available for dogs. Surely this is illogical. Please just watch this clip. This is Bonnie Milton, and this is her family home. The kitchen is where her bed, her water bowl, her food bowl, and the exit to the toilet is. Now watch what she does to get to the kitchen area. The slippery floor, the steep steps. She has lumbosacral disease, which means that her pelvis is very, very painful, and she has bilateral sciatica signs. The owner loves this dog and just was unaware of her dog's daily requirements to access the essentials such as food, water and toilet. The dog was also very anxious and wanted to always be with the owner, another sign of discomfort. This is another dog in their home environment, and if you watch the clip, it pauses, hesitates, unsure, and the back legs slip away where there's no traction as it tries to negotiate the step. These all add up, if being done multiple times a day, can have a serious impact in the dog's pain state. This is another clip and shows that these laminate floors are slippery. As you can see, those feet offer no traction and keep slipping away. Repetitive injuries. Steps in and out of the property. As you can see, that last section was really hard. The dog takes a run up, clears the first 2 to 3, but the last 2 are really difficult and they're very prone to further injury at this point. Most of us can't move houses for our dogs, but we certainly could look at that daily exercise, that daily routine, and think about how to make it easier, such as using a harness to support them up those steps. So module 6, a shorter one. In summary, lifestyle changes are commonplace in human management of arthritis. We call them joint protection or ergonomics, and they are a logical consideration when managing canine arthritis. Lifestyle changes are easy and cost-effective to implement. Considering the different aspects of the dog's life and adapting them individually is a logical way to implement these changes. Lifestyle changes will likely have a positive effect on the pain levels and the progression of your dog's arthritis and are totally achievable for people from all different backgrounds and different incomes.